Hi, this is Linda, Nursing 210, Assessment Video 2. This is Rita. She's given me verbal permission to be my patient for this exam. So I would go, before I came into my patient's room, I would wash my hands, introduce myself, and make sure she has privacy during the exam. All right, so I'm going to assess her eyebrows now. Her eyebrows are light brown in color. They're thin. They're symmetrical. Can you move them up and down? She can move them up and down equally. Her eyes are round, symmetrical to her face. She is blinking without difficulty. There's no discharge or drainage noted. There's no lid lag noted. Her sclera is white without any imperfections. The conjuncti is pink and moist. Have you had any vision problems at all? Do you wear contacts or glasses?
Glasses.
You do wear glasses, okay. And so she would have had an eye exam at the eye doctor where they would test for the Snellen test and the Rosenbaum test. The Snellen test is for far vision, and the Rosenbaum is for near vision. And they would do that with a card, and they would test her with her glasses and without. Okay. So next, I would have her focus on an object. This is accommodation. I want her to be able to focus. So just look at this as I bring it close. Good. So she is able to focus her eyes on an object that is near and close, and as she does that, her pupils do change appropriately. So now we're going to do the 6 cardinals of gaze, and what I'm going to have her do is you're going to keep your head still, and you're going to follow this object with your eyes only. I'm going to do it in the H pattern, and I will note for any nystagmatisms or anything like that, like rapid movements of the eyes. Okay. So just keep your head still. Okay, good. I didn't notice any frequent eye movement that would be of concern. So the next thing that we will do is I'm going to do the conductive test, which is she's going to cover one of her eyes. So I'm going to have you cover your right eye, and I'm going to cover my left eye. And this is going to show her peripheral vision. So this is the bunny. When you see the bunny, I want you to let me know when you see it. Okay?
Okay. Okay. Okay.
Okay. And I would do this in both eyes, but we're not going to do that today. So the next thing I'm going to do is we're going to do the cranial nerves 3, 4, and 6 of the eyes, which are the oculomotor, the trochlear, and the abducens. Sorry if I'm mispronouncing them like crazy. So I will, with my ophthalmoscope, I will be assessing the inner part of her eyes. You can look up for me, and down, and look up, and look down. And I am assessing the optic nerve, the optic globe, or the optic disc, which should be oval and clear in color. I'm also going to be looking at the retina and making sure that the retina is intact, and the red reflex with the light, which would show, like we call it, the twinkle of the eye, which would show. Now we will move on to the ears, which I'm trying to fix my scope. The retina also, you would note that there's no like scratches or abrasions on the eye. We will move on to the hearing portion of our exam. Rita, do you have any hearing difficulties in your ears at all? Okay. So I'm going to assess the symmetry of her ears. Her ears are aligned to her eyes and are well proportioned. The top of her eyes, the peanut, recoil all by themselves and look good. I'm going to assess the inner part of her eye. Ear. The inner part of her ear, not her eye. Okay. Everything looks clear. I can see the tympanic membrane, which is gray and pearly in color. And all her landmarks, I can see the light. When I assess the ear, the light, the cone on the right side would be 5 o'clock. If I were to assess the left ear, it would be at 7 o'clock. And now I'm going to do the whisper test. So what I'm going to do is stand behind her, whisper a 2-syllable word, and have her repeat it. Again, I would do this in both ears at the time.
Baseball.
Okay, good. And with the ears, we do cranial nerve 8. I'm going to have you actually, you can stay right there. The cranial nerve 8 is for the acoustic hearing. This is a tuning fork. I'm going to do a couple of tests with the tuning fork to assess her hearing. If I can get it to work. Shoot. So you tell me when you stop hearing that vibration.
Now.
Okay, good. Now I'm going to do the mastoid processes behind the ear, and I would do this bilaterally with both of them as well. And can you still hear it? Okay, perfect. So again, I would do that with both sides of the ears. And that would be the one that we did on the top of the head would be the Webner test, and the one by the mastoid would be the Rhine test. Okay. When I looked inside her ears too, there was no redness or bulging or any drainage or discharge. And again, I would assess both of those ears. So now we're going to do the thorax, the lungs, and the chest. Okay. Actually, we're going to go with the mouth first. So her lips are a little bit chapped, but pink. They're symmetrical when she smiles. Go ahead and smile. She smiles. Her smile is symmetric. I'm going to see your teeth. Her teeth are clean. They're white. She takes very good care of them, I can tell. Now, I would normally have gloves on and be able to look inside. So I would look and I would actually count her teeth with a tongue blade. So I'm going to have you open 1, 2, 3, 4, 5, 6, 7. So it looks like there's 27 teeth total on the top and the bottom together. I'm looking for any dental decay or anything like that. I don't see any of that. She has some old fillings that look intact. Okay. Her gums are moist and pink. And there's no receding gum line. Her mucomucosa in her cheeks are pink and moist. There's no lesions, bumps, or scrapes on them. Open up your mouth again. Say ah. I would stick my finger in her mouth and check for her hard palate and her soft palate to make sure that there's no openings and those are clear. Stick out your tongue and say ah. So I'm looking in the back of her throat. She has no tonsils, but there's no redness, white spots, or anything like that. And then I'm going to assess your tongue. And move your tongue from side to side. Okay, great. And the frenulums I'm going to look at too. The one under her tongue is intact. The one on top is intact. And the one on the bottom is also intact. The tongue movement is cranial nerve 12, which is the hypoglossal cranial nerve. We're also going to assess for their mouth cranial nerve 9 and 10, which is the glossopharyngeal and the gag reflex. Now we're going to do her nose. Okay, so her nose is symmetrical. It's proportioned to her face. Any tenderness in your nose? No. No tenderness in her nose. I am going to look in her nose and her nares. I'm going to assess for symmetry and any occlusions, make sure she can move air through both her nares. Good, nice deep breath. Good. Her nose is clean. There's no drainage or discharge. Sorry. She doesn't appear to have any distress in her breathing. We're going to test her smell. This is cranial nerve number 1, which is the olfactory smelling test. So I'm going to have her close your eyes. I'm going to give you a scent and would like you to tell me what it is.
Apple.
Correct.
Pumpkin.
Pumpkin. Perfect. Her septum also, you can open your eyes. Her septum is also midline without any deviations as well. So now we will do her thorax and her lung assessment. So I'm going to have her kind of stand up so we can see a little bit more. So I would actually have her go without her shirt currently, but we're not going to do that to her. You can just stand right there for right now. So I would have her be undressed, and I would look at her skin, assess her skin for any bumps, bruising, macules, anything abnormal. I'm also going to palpate the front and the back. Do you need to cough?
No, that's okay.
And I'm going to, again, palpate for any lumps, bumps, or anything. And I'm going to feel as she breathes in and out, and I don't notice any breweries or murmurs. Okay. Perfect. I am going to listen to her lungs in the anterior part first. Go ahead and take some nice deep breaths in and out. And I'm listening for any crackles or abnormal lung sounds, and I want to do them bilaterally. And I would have her lift up her breast tissue so I could actually make sure I could hear in the right spot. Good. Any trouble breathing in and out? Good. So then I would assess her back. So I'm going to have you turn to the back. Again, we're going to do her posterior lungs. You start above the scapula. Every time you feel my stethoscope on your back, can you take a nice deep breath for me? And again, I'm going to do this in the same kind of pattern bilaterally. Nice deep breath. Okay. And then I am going to feel for the 10th intercostal space, and this is going to show me the thoracic expansion. Hold on. Okay, go ahead and take a nice deep breath, and that is equal and symmetrical. Okay, and now I'll have you turned to the back. I'm going to do the percussion aspect of this exam. And how I am going to do that is I will take my left hand, and I am going to tap my middle finger with my other middle finger, and I am tapping the sound. I don't want it to hear any dullness. Good. So as I do that, I am going to actually do that again, and I'm going to find the space that when it becomes a little bit more dull, I will mark it. Okay. So if I would have a pen and I would mark it and I would keep tapping till I find the other space, mark it. I would measure it with a tape measure to make sure that that is the inspiratory and expiratory parts, and it should be 3 to 6 centimeters in diameter, which is the normal. Okay. Okay, so now I'm going to do the assessment for firmitis, which is the 99 test. So what I'm going to do with the back of my hand is every time I put my hands on you, I want you to say 99. And what I'm feeling for that is the vibration against my hands. Go ahead.
99, 99, 99, 99, 99, 99.
Okay, good. And I could feel that vibration. Okay. So I'm going to have you turn around. Okay. And I am going to do the cardiac portion of her assessment. So I'm going to listen with the bell of my stethoscope and the bell and the diaphragm as well. And the first one I'm going to do is the 5th intercostal space. Which is the PMI. And then I would listen to all the intercostal spaces. So I'm going to do the 4th intercostal space on the left side, which is the tricuspid. Then I would do the 3rd intercostal space, left sternal border, which is the Erb's point. The 2nd intercostal space on the right is the aortic. Sorry, right here. And I would be listening for any S1, any abnormal heart sounds. Normal heart sounds are S1, S2, the left dub, and those sound good. Okay. Then I would palpate the temporal pulsations, which are normal. I would do the carotid, and you would do one side at a time. I would do her brachial pulses. And normally they would be like laying down for this part. Her radial pulses. Okay, good. And then I'll do the palpatile. I'm going to just move this down here. Okay. And move your chair just so you can see a little bit. Can you see me? Okay. So I would feel the palpatile just behind the knees, a little bit right here, and then the posterior tibula, and then the pedal pulse. And those are all normal. They're palpate normal. Okay. And that concludes that assessment video. Thank you.